Speech therapists can play different roles in all different stages of the care pathway, really, because we're working with communication and eating, swallowing, drinking. We can work from the earlier stages when people notice very mild difficulties. I mean, we do work with people who themselves have said, I've noticed something with my communication, you know, I've got problems with word finding or whatever. And we can support that person directly, that person with dementia, in their everyday life. Sometimes it's supporting them in work for younger people with dementia. And that can be right the way through to later stages when communication becomes more challenging. It might be working with carers and family members to keep the person connected to the people around them in terms of communication. And then looking at eating and swallowing and drinking, those things tend to come in towards the later stages of dementia. And we have quite a role to play in keeping people's nutritional intake going, keeping people's meal times a pleasurable experience. And there's a big role to play in end-of-life planning around nutrition, eating and drinking. So it depends on different services have target different bits of that pathway, but potentially, and certainly that's what the evidence synthesis that Pam Enderby recently did, looking at the role of speech and language therapists, that we've got a role to play across all different aspects of that pathway.
Speech and language therapists have a variety of roles in the care pathway for people with dementia. I think that speech and language therapists have a big role in assessing people and differentially diagnosing the different types of dementia, which influences the ability for medical professionals to diagnose the different varieties, and we can assist in that diagnosis, which will then allow that individual to access the most appropriate intervention, be it pharmacologically or be it therapeutically, with the right type of language therapy from the speech and language therapists, or the right type of cognitive therapy with the occupational therapists or the psychologists. And we also have roles further on down that care pathway. So, for example, in providing interventions, and not only directly to the individual with communication difficulties, but also to the family and carers around that individual. So actually lots of carer education.
Speech and language therapists can assist those people living with dementia who have communication issues by working directly with the person to look at strategies and help develop skills to cope with the difficulties they might be experiencing. So those difficulties might be word finding, with memory, with reading, with writing, but not just also working with the person, working with their carers or families, because obviously communication is always two-way. And people are being diagnosed earlier now, and there is a lot that a speech therapist can do at the early stages, working with people with dementia, but also through to other stages of dementia as well. And those strategies and support work can actually help some people stay doing their hobbies, their everyday life, their work, and really help them continue the things they want to be doing. Another important aspect is actually helping the person come to some kind of understanding of what the dementia is and why they're having those difficulties, and that's really crucial in sort of being able to move forward and develop ways of living with the difficulty. So we can have input as well to carers information groups, post-diagnostic groups as well, which really, training can be a big part of the role. And something that in our service we're using a lot of as well is life story work at any stage of a dementia, which we find is a really invaluable tool because what we find is that you can use a lot of the therapy anchored around the life story work to actually build on conversation strategies and develop other strategies through doing the work. And not only that, it's something that is a brilliant tool in maintaining identity.
I think to improve services for people with dementia, I think we all have an ethical duty to make sure that people with dementia have the same access as other client groups. I think because of the very nature of dementia, it's sometimes difficult for people with dementia's voice to be heard. And I think as speech and language therapists, and indeed all healthcare professionals, we have a duty of care to make sure that we really listen to the voice of people with dementia. And so I think we can all individually in our services think, do people with dementia have the same access? Would they get the same quality of service? Is there something that is not happening for people with dementia that's happening for other client groups? And I think that's a really important message. I think together we can exchange ideas about how we work with people with dementia. We can be more creative in the ways we work. We can swap ideas. Certainly in those therapists that work with dementia, we have two very active clinical networks for speech and language therapists, one in the south, one in the north, and we do lots of training and case studies and explore different ways of working. And so when people are new to dementia care, new therapists, we can support those therapists in different ways of working, what the evidence base is, what the research is, but also what people are doing practically out in the field. And I think it's about having that collective voice really to improve the care for people with dementia and their families. In terms of competencies for speech and language therapists working with people with dementia, I mean obviously one of the important things is they have to understand dementia, the various different kinds of dementias and how that affects the brain and how that affects people's symptoms. But people also have to understand the lived experience of people with dementia. They have to understand what it's like to live with dementia, to care for a family member of a person with dementia. And people have to be able to have the skills to really listen to those people's experiences. So if we're delivering services, it really has to be tailored to those individual circumstances and those people's needs. I think it's about being very innovative and constantly thinking about different ways of working and creative ways to meet the needs of people with dementia and their carers.
I've recently, in the last 18 months, transferred into the area of dementia from previously having a background in working with adults, largely with stroke. And with this being an area that we don't have many speech and language therapists working in at the moment, I just wanted to reassure people that there are a lot of transferable skills that you will have that you can take across to this client group. So just having a knowledge of, first of all, communication profiling, so being able to assess and identify what people's abilities are, as well as the areas that they're having difficulty, is really important and helpful in the diagnostic stage, as well as being able to provide support to people in terms of how to communicate, as well as training others on maximising their communication skills. So I think it's important that people can see that a lot of the skills that you might use in other client groups do move across to the dementia area as well.
Thinking about challenges for speech and language therapists working with people with dementia, I think one of the very real challenges we have to acknowledge is that if you don't have any ring-fenced time to work with people with dementia and you're getting people with dementia on your general caseload, it can be very difficult to maintain your knowledge of dementia and stroke and head injury and everything else all at the same time. So actually, where it works best is where people are given even just a small amount of time to ring-fence that work. It might be even just a couple of sessions. What's really clear is that there is an inequity of service provision across the UK. So in some areas there's very good services for people with dementia who have communication problems. They can experience they can see therapists who are experiencing dementia, have quite a comprehensive service provision. And then in other areas there's no service at all for those people. So if you have a communication problem and you have dementia, you might not be able to access a service at all. And I think for many of us working in dementia care, we feel that is extremely unfair. And people that have dementia should be able to access the same level of service as people who have stroke or head injury or a stammer or whatever. So that's really where the position paper initially came from, to try and look at this inequity and really challenge that place and to see where we can move forward to develop better services for people with dementia and their families.